I'd like to welcome Liliane Fan, International Director and co-founder of the Gitani Foundation and the chair of the Rohingya Working Group with the Asia Pacific Refugee Rights Network. Since we'll be talking about the Rohingya refugee population in Malaysia, I'd like to start by getting a quick update about the current situation regarding the COVID-19 pandemic in the country and how that has affected the Rohingya population.
Because Malaysia is a country which is, number one, extremely diverse, and number two, has a large number of foreigners, of migrants, some of whom are migrants, some of who are refugees. The Rohingya refugees are the largest group of refugees in the country. It's over 90% or around 90% of the refugees in the country are, in fact, Rohingya. It was really important to ensure that all refugees, actually, and all migrants, all people in Malaysia who didn't speak the national language, were having access to information of how to get treated, where to go. And it was challenging because basically, there's a lack of clarity on the status of many refugees, and in fact also of many migrants. There's a large number of migrants here who, in fact, don't have proper documentation or have fallen out of proper documentation for one reason or another. And of course, most refugees are also here in a kind of a grey area, because while Malaysia is increasingly respecting, the UNHCR card as a document which in fact allows a bit of protection for refugees, it doesn't legally recognize it as a status, right? Malaysia has not signed the Refugee Convention, and therefore there was a lot of fear by the refugee community about even coming forward, and when there was a risk and people were concerned about actually the risk of being infected by the virus, nobody really felt that they were comfortable coming forward for testing until the government really issued very clear guidelines. And it was really a directive from the health ministry that said any foreigner who has symptoms or is showing symptoms is entitled to free testing and free treatment, because this was a really good step by the government, because it really showed that the government's key concern was really to control the spread of the virus, and of course viruses don't recognize the boundaries of passports, and don't make distinctions about immigration status. So it was a very smart move, I think, a very intelligent move to take on the Malaysian government side. But again, that information, on that policy took some time to get out to the various populations, and a lot of work was done by UNHCR and NGO partners, working hand in hand with the Ministry of Health to make sure those messages were getting out in the languages that they needed to be in. For Rohingya, of course, it's not a written language, so those messages had to go out in audio, in voice form, and that was very important as well to make sure they were reaching the right, methods of circulation. As the COVID situation, progressed, things did become more stable. Thanks to the very strong policies by the government and really quite strict movement restrictions and SOPs that were put in place. But at the same time, the government also has started to be a lot more concerned about controlling the situation of undocumented migrants in the country, both in terms of those who were trying to arrive, and that was actually a few Rohingya boats that had left from Cox's Bazar and Teknaf in Bangladesh, that had started to arrive right around the time of late March, April, and again in June, and this kind of triggered some reactions, both by social media, and by the government in a slightly different way. So the government started to issue very strong statements about not allowing boats to land, number one, trying to find ways that were possible, even though they actually did facilitate a few cases of disembarkation, but it was very reluctantly, and with the understanding and the statements that as much as Malaysia still is very concerned about the situation of the Rohingya and the larger situation of Rakhine State, particularly under this COVID context. Within this COVID context, it is just not possible anymore to treat Malaysia as if it's a kind of a destination country for refugees. And this was a message that came out very clearly from the government. The second thing was, of course, it's linked to control of tightening of the borders, right? And that was a really strong focus, I think, for all governments, but including for Malaysia. And that also, went hand in hand with an intensification of the immigration departments basically trying to, conduct operations to ensure that we were looking at identifying undocumented migrants in a lot of the areas which were under the red zone, which was called the EMCO, the Enhanced Movement Control Order. As soon as the EMCO restrictions were lifted, what we saw in many areas was, the authorities going in then and then conducting these sort of sweeps of looking at who had documents and who didn't have documents. Luckily, most UNHCR card holders were released and were not taken into detention. But there are lots of people who don't have UNHCR cards, maybe have a letter, lots of cards expired, lots of letters expired, during the MCO period as well. And a lot of people, who actually are in a position where, they could, where they're actually seeking asylum, in fact, don't have documents yet. They haven't had a chance to be processed by UNHCR yet. So there are a lot of people in that gray area. There were, of course, a lot of undocumented migrants who then were taken into detention. Actually what we started seeing was an increase in cases of COVID-19 in the detention centers. Understandably, of course, the immigration does have concerns about the levels of undocumented migrants in the country, but I think the way that operations have been done, it could have been done at a different time, for example, and in a way that actually didn't put people at more risk of contracting the virus.
Another developing topic has been the discussion about Rohingya refugees on social media. What kind of emerging patterns have you been tracking in Malaysia?
So as these operations started increasing, the sentiment from the public, particularly on social media, but also in real life, started to really rise against undocumented migrants. And that has also had an impact on refugees, and particularly the Rohingya refugees. So one thing that happened when the boat started arriving was that there was a sudden and very intense campaign of xenophobia and anti-Rohingya rhetoric that emerged on social media. And it started to, really actually spread a lot of fake news about the Rohingya. A lot of very sensitive issues were brought up, very deliberately to stir up more hatred against the Rohingya. So it was really like a hate campaign. And it was really very systematic because, at one point there were literally tens of, campaigns coming up, and every time you took one down, every time you took a petition down, more would come up with, lots and lots of followers. And it seemed like that was very orchestrated. But I think what was important to see was the fact that, the impact that it had on public opinion was actually very real. And that was because there was, number one, concern about undocumented migrants, and it was mixed in with a concern of COVID. And I think that itself is, something which needs to be really managed properly, because I think, blaming migrants for COVID is really something that, is extremely unfair when this is a virus that, really doesn't come from any one single source. It's something that spreads from person to person very easily. So this blame game, I think, has been very dangerous, but unfortunately, it's been something that has become quite popular in Malaysia. I wouldn't say amongst everyone, but definitely amongst certain groups. The impact, I think, on the Rohingya has been very pronounced as well. So, many people then from the Rohingya community became very worried about being identified, being harassed, randomly on the street. And it did happen a number of times. There actually have been real incidents of harassment taking place as well, because suddenly there are people who suddenly look at the Rohingya as being a big problem. But I think underlying all of that are some very real issues that need to be addressed, and that is one of the things that we in Gitania Foundation are really interested in engaging on. We feel that the rhetoric and the hate speech and the campaigns against the Rohingya would not really have resonated if there were no issues, right? If there was an ideal situation where the Rohingya community and other refugees were living in very close, interaction and in social cohesion with the host communities. And in fact, the research that we conducted, with Rohingya refugees and host communities through the support of Sasakawa Peace Foundation indicated that some of these issues that were coming up during this hate speech campaign, which were underlying it, in fact, were already there, before the COVID context, before these campaigns started arising. And just to list some of those issues, I mean, these are things that came up in our research as well. It's actually very practical day-to-day issues, amongst neighbors, which I think are quite common in most societies, which are things about feeling a bit insecure about not understanding the language of the people, of your neighbors, right? Of, this group of people who live in your community, not feeling that they understand your language as well, not feeling that, they understand your culture, right? That there are cultural norms within the community which are very important, particularly here for the Malay community. Those are very important, and they're subtle. And these are things I think which, the Malay community in particular has felt uncomfortable with, because they have been living now side by side with Rohingya communities and other refugees and migrants, and feel that there's very little communication and there's no real channel for that. The other thing is basic things like hygiene. Hygiene within the community. There are different types of hygiene practices, different levels of awareness, and many communities feel that amongst the Rohingya, they don't have a similar level of education about hygiene, and that was coming up a lot, in the research that we were doing, and also was reflected in, some of these social media campaigns and comments that were being generated as well. So if one actually does try to tackle these issues in a pragmatic way, there is a way of addressing them, because these are not issues which are totally unresolvable. I mean, these are all issues which any neighborhood, any community could face, and there are ways of addressing them. So on that level, I think there's a way of bringing communities closer together. Another big issue, of course, was economic livelihoods. COVID situation has made particularly vulnerable communities a lot more vulnerable, but even communities who perhaps were not vulnerable before have been exposed to a lot more vulnerability because of the difficulty in the job situation. Many people haven't been able to continue work. Many people have lost their jobs. Many people have used up their savings, so there's a real struggle that's taking place just amongst ordinary Malaysians. But there again, I feel that, certainly in the conversations we've had and the work that we've been doing with both the government and civil society and the refugee community, that there's a way to work through those issues as well, because it really is, it's not about the government not understanding that refugees need to work. I mean, they do understand that refugees need to work, but they would like to regulate it. They would like to actually ensure that it's very clear that, these are the sectors where refugees need to work. It does become very challenging because you've got, operations taking place and, negative sentiment on the rise, and people feeling, starting to feel threatened by refugee presence and Rohingyas working in certain areas. And all that is happening at a time when you don't yet have official policy, even though it is being worked on, but it's not quite there yet. So it's a very challenging time, I would say. And I think, it definitely needs a lot more work and a lot more attention from all the various stakeholders, who are involved in trying to advance the situation.
And what do you see as the main enduring challenges to the integration of these refugees into Malaysian society? For example, what steps has the Malaysian government taken to address these issues? Or what would you like to see moving forward?
One of the things I think which nobody should take their eye off is that, this crisis is something which has originated in Myanmar, and the solutions will come from Myanmar. The foreign policy level of attention to this issue needs to be stepped up, and we need to keep that as the ultimate goal, ensuring that people have a safe way to return voluntarily and in safety and in dignity. The second thing is that we need to ensure that internally, we have to look at, given the fact that none of these solutions will come quickly, right? There has to be a way to improve the situation here temporarily and ensure that refugees, all refugees, but the Rohingya, of course, are the largest group within that, will have a level of protection and rights, even just for, to make the situation more sustainable here for our own citizens, so that we don't feel insecure about, people working in a grey area or, in an undocumented way, or not knowing the national language. I mean, all of these things can be resolved through proper regulation, through proper attention, having clear sectors where people can work, having a clear legal pathway for temporary work for refugees, having clear programs of educating refugees in, national norms and national culture, understanding the national language, at least, basic understanding of Malay. It's extremely important. I think, the documentation issue is absolutely critical, within kind of the hierarchy of priorities, right? I mean, there's so much that needs to be done for refugees, but documentation, making sure that there's actually a way of making that distinction. Refugees are not undocumented migrants. Refugees are, people who need protection, and there should be a category that really kind of recognizes them, even without us having to sign the convention. I mean, even if Malaysia isn't going to be ready to sign the convention, we can create domestic law, right, to or amend, existing laws to ensure that there is that legal documentation, that legal recognition that's given to refugees. And then, the access to services, the access to livelihood. So ensuring that, that clarity on work rights, ensuring there's some policy on education for, the large number of refugee children and youth. And the reality is that, allowing for more rights for refugees will also benefit the country, both at the state level and in terms of, being able to generate more revenue for the country, as well as at the community level, right? And even generating jobs for locals, right? I mean, imagine, that we needed to start programs on educating refugees on the national culture and on Malaysia. It's only Malaysians who can do that, right? It will have to be Malaysians who will be doing the teaching of language and running these programs. And I do see that there's a will, on both sides to have those conversations. It will take more time, and I hope that there'll be more support and more spaces and fora that are opened up, for those conversations and that dialogue to take place.